Pass your CNA test, 60 free practice questions. Question 1. You are caring for a resident in an Alzheimer's unit in a nursing home. The resident is repeatedly pushing on the locked door trying to exit the building. Which of the following would be your first response? Option A. Unlock the door and allow the resident to exit the building. Option B. Take hold of the resident's elbow and direct them toward the room. Option C. Attempt to verbally reorient or redirect the resident back to their room. Option D. Assist the resident to their room and apply restraints to prevent her from leaving. The correct answer is option C. Attempt to verbally reorient or redirect the resident back to their room. Approaching the resident calmly and trying to verbally reorient and redirect the resident back to their room would be the first response. If the resident refuses to return to their room or becomes verbally or physically aggressive, it would then be appropriate to notify the nurse. While physically touching the resident may be a secondary response, this would not be the best initial response as it may cause the resident to become physically or verbally aggressive. This could escalate into an unsafe situation for the resident. Unlocking a locked door in an Alzheimer's unit to allow the resident through would not be appropriate. The resident may become lost or could fall in an unfamiliar environment. It is appropriate to assist the resident back to their room, however restraints should only be applied by a nurse and with a provider's order. Other interventions should always be tried first. Question 2. You are working in a dual occupancy room in a long-term care facility when the residents start arguing back and forth from their beds. What is the best response? Option A. Tell the residents they must stop arguing. Option B. Notify the nurse or resident care manager. Option C. Change the room for one resident. Option D. Pull the curtain between the two residents. The correct answer is option B. Notify the nurse or resident care manager. It is best to notify the nurse or care manager as soon as possible as more experienced staff members may be necessary to prevent the situation from escalating further. Telling the residents to stop arguing may exacerbate the argument and the CNA needs to remain impartial to the residents' conversation. A resident should not be moved to another room without instruction from the care manager or nursing supervisor. Pulling the curtain can help, but the residents will still argue with the curtain in place. Question 3. Which of the following is most likely to de-escalate a disoriented patient who is starting to become verbally abusive? Option A. Address their concerns in a slow and calm manner. Option B. Shout at them to snap out of it. Option C. Close the door to their room. Option D. Physically assist the patient back into a supine position in bed. The correct answer is option A. Address their concerns in a slow and calm manner. The best way to de-escalate an agitated patient is to talk in a slow and calm manner. Physically engaging with them or shouting may agitate the patient further. Closing the door to the room may not be safe in a disoriented patient, who is at risk for falls. It is best to not physically touch the patient who is agitated unless they accept your assistance.